Sorry about that, everybody. Little glitch with the internet. I'm working from home today, so like not in my usual spot. Good afternoon and hello to everyone joining us live today for our ASIS live stream and those catching us on the replay later and the recording. Thanks for joining us for these great informative session again. And I'm so happy to welcome back Ruth Werner, who was so gracious to join us when a little bit early on and when I started doing these live streams. I looked back, it was April 2021 that she came on and talked a lot about her background and how she got to be the queen of pathology. So we're going to talk to her a little bit more today. And today's topic, I love talking about it so much because I feel like there's still not a right consensus of how we're handling the situation. So, and talking about how we're working with medical teams and making healthcare decisions with our clients. And so I asked her to please come on and to talk about this. So let's bring her on and say hi. Hello, Miss Ruth Werner. How are you?
Well, hello, Miss Michelle. It's so good to be here with you again.
Yeah, thanks for coming on. So I know you did come on to our live stream before, and we talked a lot about how you came into starting your amazing textbook that we all use and love and sleep with sometimes and just love on all the
Don't
time.
sleep with the textbook.
It's a very 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 supportive because it's so big. It's got so much stuff in it. It's amazing. And like just off topic, but kind of on topic is the stuff that got pulled out to go digitally, and it's still like this huge text and huge resource for us. So big thanks on that. So if anyone's interested in finding like that history of that, go back to our live stream playlist on our YouTube page. And it was in April of 2021. Really great story of how you came into just giving us this amazing resource that takes a lot of work, I can imagine, from your end to do. So thank you for that. And so with that, with all the complications with pathologies and what's going on for people and how we make decisions about how to work on people, is this topic that I wanted to talk about today, and that is the getting the doctor's note, because we're in this service industry that just so happens to cross over.
There's fighting words.
I know, right? I know. This so happens to also be healthcare, and us trying to find our role as massage therapists of where we lie and what our authority is and who we're asking for permission to do things. It's just like this huge, like, what are we supposed to do? And so let's just kind of chat about that. So from your perspective and what you've seen in the industry, tell us a little background about this whole get a doctor's note situation.
Well, I will say, let's do a tiny bit of history, which is in recent American history of massage therapy education. And this is something we went over in our previous live chat. We talked about how massage therapists were educated to work with healthy people who had a little extra money, right? That was sort of our target market. Most schools were not teaching geriatric massage or working with disabled people massage or, specialty sort of things like that. Okay. So the history of our education in this country is really focused on working with healthy people. And we all know that people who have chronic health issues also seek out massage. And that's one of the reasons that pathology has become a really important topic. What has happened in the last 35 or more years is more and more people with chronic health issues want to incorporate massage into part of their care because they notice that it improves their quality of life. And we have all kinds of data about that. But, the most important support for that is your client who keeps rebooking because you're providing something important to them. Right. So what this means is we are seeing more and more often clients who have complex or serious or sometimes even life-threatening diseases and conditions, and they want to incorporate massage therapy, and we want to be safe, which is awesome. And one of the most wonderful things about our profession is that massage therapy, compared to other kinds of interventions, especially those that involve knives or drugs, massage therapy is an incredibly safe way to help people live with a challenging situation. And we want to make sure that it stays that way.
Mm-hmm.
So when we have a client who has something complicated and we're not 100% sure that our skills, your hands-on skills, which are going to look really different from mine. Mine are quite narrow. Yours are probably a lot broader than mine. But we want to make sure that we have within our skill set a way to work with this client
Mm-hmm.
toward their goals that is not going to put them at risk for an adverse event.
Right.
And that adverse event might be something like throwing a blood clot or spreading infection or disrupting scar tissue that is not ready to be disrupted yet. Or there's all kinds of adverse events that we can think about.
Right.
They don't happen very often because massage therapists tend to be, because we tend to be very cautious, which is excellent, and B, because massage is usually pretty safe. And if we encourage our clients to say, stop it when it hurts, then, it's safer, but not everybody does that.
That's a whole other topic.
Not all clients do that, right? Yeah. So it is a natural and, in its on its surface, a very healthy response or reaction or reflex to having someone visit us whose health situation might be too complicated for us to make a good decision on by ourselves.
Right.
To say, can you ask your doctor if massage is okay? Right? Or for us to, in some way or other, get in touch with their doctor, although that's quite difficult. But I remember when I went to massage school, what we learned was, and this is practically verbatim, if you're not sure massage is safe, call their doctor.
Yeah.
Like that's going to work, right? I mean, I can't call my doctor and talk to him. So much less trying to call someone else's.
Right.
But we can ask our clients to ask on our behalf, on their, for, so that they are the intermediary in that conversation. And, I get it. I get wanting a doctor's permission. I get wanting a doctor's note that says, yeah, sure, massage is fine. Because that makes us feel safe. And really when I analyzed this, I came up with 3 main reasons that people would do this. One is because doctors know more about anatomy and physiology and pathology than we do. And that's generally true. Although I think someone who practices massage and is up to speed on their musculoskeletal system probably is going to be better suited to like identifying musculoskeletal issues than your general practitioner who's been out of school for 30 years or something, right? But by and large, in terms of the big picture things, yeah, sure, absolutely, doctors know more about A&P and pathology than we do. And so what that makes them is a really good source of information. Okay? Information is not the same as permission.
Right.
Another reason that we might think that a doctor's note is a good idea is we think a doctor's note is going to keep us safe. That a doctor would never recommend massage for someone for whom massage is not safe. But that's not a safe assumption.
Right.
We can't ask doctors to protect us from our bad choices. Right? And when when your client says, my massage therapist wants to make sure that massage is okay for me, your client may not be able to describe your work in any useful terms. Your doctor may not be familiar with myofascial release versus craniosacral work versus manual lymph drainage. 3 incredibly different ways of approaching working with the body.
Right.
Or PNF or neuromuscular technique or, any of the other gazillion different approaches. And it's not a doctor's responsibility to know what those are. And so when you have someone with a complicated situation, just saying, is massage okay? Either from your mouth or from your client's mouth, not enough information on which to make a judgment. But because massage is traditionally so safe and because clients really love it, there are doctors who are inclined to say, well, yeah, sure. If you probably won't hurt you. And then the massage therapist thinks, oh, okay, cool. We're safe. And we can do anything. We can do anything because your doctor cleared you for massage.
Right.
Okay.
Yeah.
And then the third reason that people, and then the third reason that people sometimes will seek a doctor's note is for legal protection. because they think that having a note, a permission slip, a prescription, especially if it's written down on something, on hard copy or in electronic copy, they think that will provide protection if they get sued for hurting somebody. And I am here to say that's not true.
Right.
A referring or prescribing physician could also be at fault. But if someone gets hurt because a massage therapist made a bad choice, a demonstrably bad choice about massage therapy, that massage therapist is both legally and ethically and frankly morally responsible for having made that bad choice. And the doctors demand, I require that this person with recently diagnosed blood clots in their left calf get deep tissue massage to improve their circulation, with special focus on the musculature of the left calf, right?
I've heard it before too. Yeah,
I have, and I have, and if that client has a problem and dies because of that work, which has happened, the massage therapist is the one who made the decision to go ahead.
Yeah.
Right. So, I wrote an article for Massage and Bodywork, and I actually have now published a course. It's a 2-hour ethics course called "The Doctor's Note is Not Good Enough and What is Better," to point out why this way of thinking about doctor's notes it's a bit of a dead end. The impulse is good. But the result might not protect massage therapists the way we think.
Right.
And so, what I would love to push out is that rather than asking for permission, we ask for information. Right. So if your client is recovering from a recent hip surgery, a hip replacement, and they want some range of motion work, well, there are some very specific limitations to the range of motion that they should be pushing.
Right.
And so, at getting information from a doctor to say, can you give me some ideas about the limitations I should be following here? That's not asking permission. That's asking for information for best outcomes. And so that's my point of view and I'm sticking to it.
Yes.
Getting permission is not the point. Getting information is the point.
Yes, absolutely. And so, excuse me. So I know with sometimes we're asking the doctors for this permission, and this like A-OK-ness. And I hear it from general people, our clients who refuse to sign intake forms because they just say, you don't need all this information. I'm just here for a massage. And I'm seeing that sometimes in the physician world where it says like they can't, no biggie, no problem. It's just a massage, right? That's where part of the problem is.
Yeah.
Yeah.
And ultimately, say it again.
Are you hearing that back or is it just me?
No, I didn't hear anything.
Oh, okay. All right. I just want to make sure that, okay. Are we good? Sorry.
Okay. Yeah. I love that massage is as safe as it is. And part of my job is to help to make sure that it continues to be safe, right? By helping people become educated about risks and benefits. But another thing I really want to push, I really, really want to see is our profession taking responsibility for our own choices, because no one is in a position to do that for us. Right. And even if you are an employee in a salon, in a resort, in a franchise or a whatever, and the expectation is you're going to do what the client asks you to do, that's within the rules and boundaries of your workplace. If your client asks you to do something or wants you to do, perform some kind of body work that you're not sure is going to serve them well, ultimately I'm sorry, but it's your choice. You have to make that decision. Right. And hopefully you'll have the support of your client If you can explain to them why you don't think this is a great idea, and can we try something else for today until we get some more information, right?
Yeah.
And hopefully you also have the support of your colleagues and your employers and the other people in this structure of where you're working. Sometimes that's not the case, which is really hard because it puts us in a very difficult situation. But it is saying that it's hard doesn't mean that it's not true. I mean, we have to do it. We have to and it doesn't happen very often, does it, Michelle? Where we have someone with a health situation that is so complicated and we don't have enough information to work safely, and we need to defer until we get more information, because almost always we can think of something that's going to be safe.
Right.
But one of the points of emphasis that I like to make is being safe is awesome. Let's be safe. But being effective, also awesome.
Right.
And if your default is, well, okay, I'm a little intimidated by this person's situation. I'm not sure what work is going to work out best for them. So I'm just going to go really late and hope for the best. Probably it will be lovely, right? Probably it will be soothing. Soothing is good.
Right.
Probably it will be pain relieving. Also good.
Right.
Doesn't, if there are things you could do that were more targeted toward your client's goals and you're too scared to do them because you don't have enough information, wouldn't it be better to get that information and add effectiveness to your safety?
Yeah.
Is safe and effective, they can go together.
Right. Yeah. No, I love that. Yeah. And you mentioned the Massage and Bodywork magazine, and I was just going to share that real quick here. Hold on a second.
Okay. Yeah, I don't have it handy, so.
Yeah, I have it here. So I wanted to, let's see, Windows.
Excuse me.
There we go.
There it is.
All right. So this, I have it on the, this is the digital copy. Of course, this is the magazine, the trade magazine through ABMP, the Associated Bodywork Massage Professionals. And just so like students who are watching know that this is part of their membership. They do get the digital copy. We always have hard copies on campus as well. But this is the issue, the January-February 2023 issue that you wrote this article for why why doctors know is not
very good. Look at that.
What is good? Yay! Look at that. We got in sync there. And I love this. I want to see if I can make this a little bit bigger here to kind of be able to. There we go. I think I lost it a little. To be able, no, I just went to the wrong page. I'll just read it out loud. But down here, key points. This is some of my favorites that we want to kind of talk about. So the key points from the article: a client with a complex health challenge can benefit from a conversation between the massage therapist and their healthcare team. So that's why I love this approach that you're suggesting. And then we'll also make sure everyone has the link to the course that you developed as well for it, is that it's not a permission seeking thing. It's a conversation start that we're having with the healthcare team. And I love the healthcare team, not just necessarily a doctor, because there's different components and parts of this healthcare team. And then the next sentence here, the key point: conversation is not the same as permission, and massage therapists do not need a doctor's permission to massage a client whose health is challenged, because ultimately it's up to the massage therapist and their client to decide the safest and most effective course of body work. And that's such a huge, important key point, I think, here. It's that's where that permission is between the informed consent process with our client and being able to have these conversations with them. So I'll remove this so we have back to our conversations here. So having that informed consent, sometimes that might seem extremely overwhelming, especially a lot of our people who are watching this as our students or people, that are still kind of learning in the field. And, going back to earlier, talking about blood clots and possibly killing someone, that sounds like, oh my gosh, I'm out of the field. That's it. No more. I'm not touching anyone unless they want pure relaxation. Is how do we get to a place of confidence or getting to that conversation with our clients and knowing how to have that conversation with them? What are some key strategies that we can start implementing or researching right now to help us better?
Right. A great question.
Mm-hmm.
So, I'm just saying this so I don't maybe won't forget it. I want to talk more about that concept of permission before we're done.
Okay.
But the question, I'm going to rephrase your question, and you can correct me if I've missed part of it. But
Okay.
the question that I heard there was, how do we know that we're safe for anybody? How do we know if we're being safe? Right?
Yeah.
Um,
Yeah.
and it's a great question. Think about, if you're a student and you are in your student clinic, or if you're working with each other, how do you know that your work is safe? If you are a practicing therapist and you already have clients with complex conditions and they're taking meds and they're under doctor's care and blah, 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 how do you know that your work is safe? And there's a finite number of ways that we figure that out. And the main one is through our education and experience, right? So you have a client who had a hip surgery 6 months ago. You have had this client before. Okay, sorry, I just got distracted. I thought I had turned off that thing. You've had a client like this before. You have a little experience and you have some ideas about how to use your experience to deliver good service or good care, to this new person. So your experience and your education. You also have the entire internet at your fingertips, but what that requires is some good information literacy, right? Being able to discern useful information from misinformation or disinformation, or just from information that isn't relevant. And that, that takes some practice. You have your colleagues, and that sometimes those colleagues can be your classmates or your teachers, or those colleagues can be people in the Facebook thread. And in that situation, let's be really careful, because very often in those, which is one of the things that prompted me to write this article and make this course, very often the response when you say, I have a client who had heart surgery 3 months ago and I'm really nervous and what should I do? I mean, I think it's cool to put that out there just to see what people say. Over and over and over again, what you get is get a doctor's note, get a doctor's permission. Don't move forward without a doctor's note. I love the caution and the conservatism there, but it's not good enough to get a doctor's note. What you need is to figure out what are the key questions that are bothering you, and to get answers to those questions. And maybe your key question is massage safe? But you have to get more detailed than that. Is the kind of massage I do safe? Can I come up with a way that I'm sure that my massage will be safe, and we can move on from there? Right. So I would love for people to place more faith in their education and their experience, to be open to getting more input that is about critical thinking and clinical decision making. And if you can hone your concerns down to a couple of specific questions, then it's time to reach out to the healthcare provider. And that's tricky, right? Because we can't, it's hard for us to do that ourselves. So we have to do it through our client. But, one of the things we can do is provide our client with an electronic letter and say, would you please upload this to your health portal? Right? Because that's how we get things into doctors' hands now. Is through our clients and into their, my chart or whatever it is, that they are using. And that actually works reasonably well. Alternatively, you can give a hard copy of the letter to your client, and the next time they go to their doctor, they hand it over. And always there's contact information so the doctor can get back in touch. And there's some rules about this too. We need to clarify that our client has given us permission to correspond with them, and that the client also gives them permission to correspond with us, because that's very important about privacy. There are some formalities that we have to observe, and they're there for a good reason. But you have the resources most of the time to figure out some safety parameters. And maybe you work together a couple of times and you discover some things about your client's body and how they respond to massage, and that will help you clarify your questions even more clearly. In the article, I provided a sample letter, a template that that you or anyone could take and sort of fill in client's name, client's condition, the description of my massage, and whatever the key questions are, because it is hard for sometimes to just sit down and say, here are my questions as clearly as I can provide them. And I would also love to just give a shout out to Alyssa Haynes at Massage Business Blueprint, who worked with me on that template and then built several more, plus some other communication guidelines that are now available as a free ebook through Massage Business Blueprint.
Yes, I should have had the link on for that, but I'll try to get. I did see that, and I do love that, and I'll make sure that it's available to our students as well. And that's a great resource that she built. And a big thanks to Alyssa. I love her work, and she's definitely very passionate about what she's passionate about. So it's just great to see it.
Yeah. Yes, it is. And she and I basically got frustrated at about the same moment with the trends we were seeing about get a doctor's note, get a doctor's permission, get a doctor's clearance.
Exactly. Yeah. I love the point you made about the being clear about your questions, because is it a matter of, do you wonder how long it's going to take to work directly over the incision site? Or is it full, can I massage at all? Or do I need positional considerations? Or, there might be some other very specific things. So something I hadn't really thought of a lot about, that I need to be specific about what I'm looking to do. Like you were saying, what
is your massage like?
Yeah.
How often are you doing it? How long are your sessions? How deep do you go?
Right. Yeah, exactly. And this is how I normally work, and it's usually an hour long, and or maybe we do 2-hour massages, and is that going to, there's all these little intricacies of me and my session and my client session, and how they normally enjoy the work or what they come for. And those are going to help a healthcare practitioner be able to open that communication with you to know exactly, well, it's okay, or no, it's not okay. Instead of that, be like, these are the limitations, so on and so forth. So like what I do with, I don't work as many hands-on hours doing the role that I'm in, but I do love working with the prenatal clients. And what I usually have them find out is if there is any limitation to their pregnancy. Do they have weight restrictions, movement restrictions, any of those kinds of things?
Restrictions, yeah.
Right. Instead of the whole, is it okay to do a massage or not? Because usually if they don't have any of the movement restrictions, then me doing a circulatory based massage is not going to move their blood more than walking and yoga and all the things that they're able to do.
Exactly.
So that's kind of the questions that I kind of lean towards myself with when I ask them about it. And when I teach our students though too, like those are the cues that I'm trying to give them, because also we're relying a lot on our clients to be able to communicate too, and to know what they need to ask as well. And to be able to give those specifics in there. I think that's great to pull out that information from them to help better make our choices too in the treatment room.
Well, and that does come back to your question about safety, because one of the simplest ways we can be safe and demonstrate that we're being safe when we demonstrate our choices when we take records, is to get pardon me, as clear an idea as possible about our clients' limitations or activities of daily living, and make sure that whatever kind of physiological adaptation we ask for with our massage stays within those parameters. So if your client is walking 2 miles in an hour, that's a moderate paced walk, but it's you're not going to push them any further than that in a 60-minute massage.
Right.
Yeah. So, generally speaking, I think it's a great idea to do what you were just describing, right? Which is to find out what activities have you been warned against, because that gives us a lot of information about their capacity for adaptation.
Right. Yeah. Especially with understanding how much we don't really move as much fluid as we thought we moved before.
Well, then there's that. Yes.
Yes. Which is so I know it's not the topic, but I'm just curious, like how, would you say like this is a really good example of things that we always just thought this is how massage worked and we kind of patted ourselves on the back and thought all this cool stuff that we're doing, and then kind of seeing that the research hasn't really backed us up with all of that.
That's so funny.
And
I actually have had a couple of instances of this just recently. My next article in Massage and Bodywork is on a condition called arthrofibrosis. And I talked with one of the world's leading experts on arthrofibrosis. So that was really cool.
fun.
And she's a fan of massage, and she talked about how massage improves circulation. And I'm like,
Does it now?
yeah, I mean, she was talking about just locally in terms of
Right. I get that.
heating up and the tissues getting looser and whatnot. And you can go along with that. But I had to put a little bit of a check on that.
Yeah.
Because
Right.
that has not been well demonstrated in the literature, depending on how you ask the question. And then I was teaching a class, today's Friday, 2 nights ago, I was teaching a class for AMTA California, and it was a research literacy class. And one of the papers we were looking at was about working with athletes. And we have this idea that massage will shorten delayed onset muscle soreness, and massage will shorten the time to return to play, and massage might, improve performance. No one has been able to consistently demonstrate any of those things. Okay. There's the research. And if you say, well, here's the research in favor of massage for DOMs, I can point you to probably twice as many things that say, yeah, we didn't find that massage really had an impact on DOMs. So, there's a fair amount of cherry picking that goes on in athletic applications.
Right.
And what it means is we have not figured out how to study this yet.
Yeah.
Which is fine. Let's continue to study it, but let's not make claims that we cannot back up.
Yeah. It's not to say, okay, let's stop massaging people to try to prevent, the muscle soreness. That's not what anyone's saying. But to give us credit is not physiologically proven.
It means maybe we're not telling the right story. We're not understanding what's really happening yet. So it needs more investigation, and it turns out to be much, much harder to investigate than we thought. And we need, people who are promoting evidence-informed work and who want for research to be part of their decision-making process, not the whole of it, part of their decision-making process, need to be aware that the research at this point is very much up in the air about certain things like circulation and muscle soreness. On the other hand, something we never expected is that the research for things like anxiety and depression is consistently and robustly strong and positive for massage. Most of us, certainly in my generation, did not go to massage school thinking I'll work with anxious people.
Right.
But that turns out to be a completely viable career path.
Yeah.
And that is extremely well supported by the data. And who knew?
I know it's mind blowing to me, and I thank you and other people trailblazers in the industry who are keeping on top of a lot of this for us, because I get it trickled down a little bit after, because there's only so much.
There's too much.
Too many hours in the day, so I leave it to the experts and get the pieces and get that. But it's something I bring up with my students a lot. I said, I'm telling you one thing right now, but please, my word isn't gold at this moment. It's not gonna. It's like maybe a mediocre silver, possibly sterling, because there's just so much we don't know. And why I love massage, and I think it's so cool, and I would be on a table every day if I can and promote it to everyone that I can. There's just so much that changes about what we understand about it. And so that's one of the other reasons too, kind of going back into what our treatment planning discussion is, that we can't just take what we learned back in whatever classroom that we were as the full truth to go forward with making those decisions as well. Right.
So so the message there for your students is what you are learning now is what we understand in this moment.
Right.
But it's a moving target.
Yeah.
And part of, what's going to keep you interested and I hope interested and engaged in the profession is that we are always learning new things. about how skin touching skin, there it is, how skin touching skin affects function.
Right.
Because it's, I learned that we were stretching fascia and relaxing muscles, but you know what is probably more of that is the nerve endings that we're getting at in the superficial fascia. And the more we understand about this, the better we can get at it and have the benefits that we are looking for on purpose instead of by accident.
Yeah.
So it's a very exciting time to enter the profession, plus which people are screaming for massage therapists.
Yes.
There's a huge shortage in the profession for people with these skills. So I am thrilled for your students who are setting out on this because the world needs us.
Yes.
But we also, need us to be ethical and staying within our scope of practice and performing an appropriate standard of care and, doing those things that keep our profession safe and strong.
Yeah, absolutely. It is a very exciting field to be in, and so many pathways to go down, and so much more than I think people realize that we are learning and hopefully teaching well to our students about decision making and treatment planning and approaches. And I know a lot of people talk about, well, it's so much more than just relaxation, which I'll fight anyone tooth and nail if they say just relaxation one more time.
Hardest kind of massage there is to give.
I there's not diminishing relaxation. It is pretty cool to be able to relax someone. So whatever. But to know too that there's many pieces to that, many facets of it, and a lot of it having to do with being educated to make these good decisions or better decisions, I guess I should say, because you never know. Kind of, you're doing the best with what you know, and so it is very exciting, and it's an amazing career choice. I don't think people realize as much of it is as cool as it is, and for us like geeks and nerds and science, lovers and people who want like detective skills and figuring things out and coming up with like all this and using your mind so much for it, not just your hands and your body. Amazing. We love it.
Yes, we do.
Yeah, it's great. And going to about the discussion about things that are changing and things that we're learning more as we go. I remember when we spoke that first time, we talking about the little like booklet basically of your first edition in a way like you made for your curriculum, and now we're on the 7th edition.
Seventh edition. Yep.
And I should have how many pages it is, but it's a little bit more than a booklet.
It is. If you include the index, it is 46 pages.
Yes. And then an appendix, a whole bunch of appendices.
There are 3 appendices online.
Yeah.
One is on a hospital-based massage, which I really love. One is on research literacy. Oh man, I'm in trouble now.
And the medications.
Oh, thank you. Yes. Yeah, that's a really important one and often undertaught.
Yes.
In massage school. And I have a couple of classes on that too. So, once you guys have graduated, or if you're already in practice and you're wondering about decision making in the context of medications, check out my online continuing education courses.
Yes.
So I have a part 1 and part 2.
Very nice. I'm a little sad. Someone in San Francisco is a yoga teacher, has myname.com. So I'm just one of these days, I'll see if I ever get it. I'm like, oh man, because I thought, who has my name? Yeah, there's someone out there. But yeah, if you go to ruthwerner.com, you get all of your courses, which you've got a ton of little, I love that they're bite size. People can get, their 1-2 hour courses. But your website, oh my gosh, so many pieces of nuggets.
No, my website is overwhelming.
I don't think overwhelming at all. And I'll just share with everyone here since I'm on it. But we do have all your courses, and
I have a big that file cabinet thing at the top refers to my archive, so if you're looking up something that I might have written or spoken about at some point, I have an archive that you can search.
Uh-huh. And with
Yeah.
new ones, with the podcast, which I love, is there's the one here, that I have a client who pathology conversations that you have through ABMP podcast.
Mhm.
And this is another one I use love a lot in this because I do. I love that these are, again, a bite size,
Yeah.
easy to break down, easy to digest conversations that you have. I think the last one was about 15 minutes or so, right? They're right,
The
right around
podcasts
there.
typically are about 15. I've been running a little bit over lately. I need to get tighter. My goal is to have it take about as long as it takes to fold a load of laundry, right? So
Are we talking fitted sheets or flat? Because that'll
yeah, right,
change.
both. So yeah,
Yes.
no, but the goal is that they're about 15 minutes long, and they are based on real life stories. So
Yes.
if we have someone who is listening to this and you have a cool I have a client who story, um, send it on in. I had one published this morning that was on a kind of an obscure, weird birth defect, but it was fascinating because it's about how the scapula connects to the rest of the body. It's called
Hmm.
Sprengel's deformity. And what happens
Mm.
is in somewhere between the 9th and 12th week of gestation, the blood flow to the scapula, and it's usually I think it's usually the left scapula, gets occluded in some way. And so the scapula doesn't form all the way. So when the baby's born, they have one scapula that's normally placed and one that's much smaller than normal and much higher than normal. And it
Mm.
can be surgically corrected, but it leads to a lifetime of some scarring and limitations and things. So,
Oh,
um,
wow.
I know it was
That's so
fascinating.
cool.
It was fascinating to
Mhm.
put that
Yeah.
together. And so, while you're walking your dog or folding your laundry or cooking supper, take a listen,
Mhm.
learn a little bit about Sprengel syndrome because it came from
Yeah.
someone who said, "I have a client who."
Yeah.
So I get to learn new things, and I love sharing that stuff. So join
Oh,
me.
that's so cool. Oh, I love
Yeah.
that. So that's through the ABMP, which you can you can go to their website directly from your website, or you can go to the ABMP podcast or find it on Spotify or wherever else this podcast as well. So that's really, really helpful. Let's see. Um, and on your website too, this is the course that we're talking about. A doctor's note is not good enough, and what is better. So clicking on that and takes you to the Ruzuku, is that the platform that you
Rizuku.
use? Or is
Rizuku
that
is my learning management platform.
uh,
And I love them because it's really, really easy to access and to use.
oh,
It's
great.
very user friendly.
Awesome. So the courses that you have, are they like mostly you're watching you do a lecture, or there
They
activities, or
are I'm so glad you asked. The courses are typically a combination of lecture and there may be activities. So for instance, this is the link to Pharmacology Part 1.
Mhm.
That's like 5 short videos
Mhm.
and a couple of activities, including learning how to there's a video on learning how to read a drug guide, like a Stedman's or a PDR or something
Oh
like
yeah.
that. And then you practice looking things up in the drug guide, right?
Okay.
So short videos on specific topics and then activities, and then there's a little quiz at the end. And there's a
Okay.
handout and fully downloadable transcripts. And I think these are pretty nice. I'm really proud. So I've got Pharmacology Part 1 and Part 2. There is one on COVID, but it's quite dated now, and I'm probably going to pull it until I get to updating it.
Okay. Yeah,
Um,
that's another one that feels like every time something comes out, it's like got to do it again.
yeah. And
Yeah.
then this is the newest one, and this one is 2 hours, and I did that because a lot of people have ethics requirements that are 2 hours. So I was careful to work with NCBTMB to make sure it met those requirements. So yeah,
Right.
so you can find those there, and I have a handful of other online courses that are offered through other hosts. So I did some work with HealWell, and I do a lot of work
Uh-huh.
with ABMP and some other hosts that you can access through my website.
Yeah, you're all over the place. I know that
I
for sure.
am I am I am just producing content. So
Yes, and we thank you for it. It's just so much out there. That's what wonderful. Just for my own personal information, from the pharmacology ones, do you cover oncology medications in either one of them?
no, I don't. That's a field that is um I actually did a class on oncology medications for S4OM, the Society for Oncology
Mhm.
Massage. But that was such a complicated topic, and I
Mm,
felt I could only scratch the surface.
yeah.
And so I really couldn't do it justice. And there are so many people who are really top-notch educators in oncology massage therapy that I decided
Mhm.
I wasn't going to try and step in that sandbox. It's not my sandbox.
Yeah. I get
So sorry, but no. The medications that we spend most time talking about are anti-inflammatories and painkillers, anything to do with heart disease and blood clotting,
that.
um,
Mhm.
and diabetes.
Okay. All right. Yeah, that
And
makes
that
sense.
was
Again,
plenty for 2 hours of
right.
oncology
It's
stuff.
why one of the reasons I was asking you, because I'm kind of working in some oncology curriculum stuff, and I'm like, I wonder if she's got something that just puts it all together for me, like everything else. She just hands me on a platter. So,
Michelle, between you and me, I can send you what I put together for S4OM, but I'm not ready to make that public
no,
because
I
it,
get that.
it
I
needs a lot
appreciate
more
that.
vetting.
Yeah. Yeah. Speaking of S4OM,
Mhm.
so there is the summit that is coming up in April, right? And I think you are going to be
I
not.
am
I know you're going to be a
I
presenter,
am
right?
presenting there. Actually, I'm going to be doing a 90-minute workshop based on what we've been talking about, which is a doctor's note is not good enough, and what is better.
Mhm.
So we'll go through a lot of what we've just talked about and then have some time to practice crafting these letters to initiate good conversations.
Nice,
So
nice.
I think that's going to be really fun. I'm looking forward to that. And then
Yeah,
I'm
that's great.
teaching I'm team teaching with a massage therapist named Judy Tudor who was very, very helpful, especially at the onset of COVID, in talking about
Mhm.
hygiene and air quality and things. And we're going to be doing a class about good hygienic practices in a, in a world with pandemics, especially for people whose immune systems are compromised.
Oh, that's
So
so
those are the 2
exciting.
classes I'll be working at S4OM. That's a terrific meeting.
Yeah, I'm registered. I'm going, so I'm
Oh,
very
awesome.
excited. So, Society for Oncology Massage, for those who don't know what lingo is, what we're
S4OM.org.
talking about,
Yeah.
and they're doing the oncology massage summit in Minnesota.
Yeah.
So,
Just outside Minneapolis.
yeah, I'm really looking forward to that. So, thankfully, my boss is a great guy and is sending me so I can go
Hey,
learn all the cool things. So, yeah, I'm very excited
good.
about that. Yeah, yeah. So when I saw your name on, I'm like, oh, I'll have to bring that up so we can chat about that too. So yeah, awesome. So we talked about the about your course and also the resources in that article from ABMP does have a link to the templates that are
Mhm.
available, the ones
And
that
the
you worked on
ebook,
with
right,
Alyssa.
the ebook
Yes.
from Massage Business Blueprint.
Yes. So that's a really, really helpful tools as well. Do you ha- do you, do you have advice for people who maybe get the response from people who say get a doctor's note to do we just ignore them and just move on to the next person, or is there a way that we can educate or suggest as more of what's better without looking like I don't know keyboard warriors or or trolls or
Keyboard
whatever it
warriors.
is. Yeah.
Yeah. My typical response, now that the article is out,
Mhm.
is to say a doctor's note might not provide you with the information or the protection that you think.
Mhm.
Here, read this article for more information.
Yeah.
You know, and anyone is invited to do that because that article is available for free to anybody. And I really
Mhm.
appreciate that so much about Massage and Bodywork, um, that you don't have to be a member to get access to the electronic version of the magazine.
Yeah.
So,
That's
yeah,
awesome. That's really, really great. Yeah, I do love. I can't speak enough praises for ABMP's resources that they give to the industry. It's what a gift. It's a
yeah,
wonderful. Which one of the other ones too is when you're a professional member at ABMP, you get your pocket pathology
yes,
access as well. So
yes.
that is an amazing tool to be able to have because when we're done with carrying around your textbook all the time might not be available to us all or we need to put it down for a minute because my shoulders are hurting. Uh, to have that access on the website as an ABMP professional member, that's really, really cool. We want to talk about.
it's a little app, and it's not all the content from the book. It's about, I don't know, 200 or 210 sort of abbreviated discussions with emphasis on the decision-making process. And the vision for that app was, your client just told you they have whatever, you have 5 minutes while they get on the table for you to like look up more information. And that's the purpose of the app.
Yeah. It's really, really helpful. Yeah.
Good.
Although your book though too, to have that chart and each section, when you have also the 5 minutes to look.
Right. The risks and benefits and accommodations. Yes. I am really, really pleased with that evolution of that part of the book. Mm-hmm. And in the earlier editions, I really shortchanged that part of the discussion, and I learned. Sometimes I'm a little slow about these things, but I learned as I went along, people were really hungry for more specific ideas. Yeah. And that's when I really began to expand, especially around the accommodations section. How can we design a session to maximize benefits and minimize risks? And of course, I have to write that in a way that's going to be relevant for someone who does structural integration and for someone who does cranial sacral work.
Right.
And that makes a really interesting writing challenge.
Yes.
It's hard to get more different than those two, those two approaches. So
you do it pretty well. You might want to consider doing it for a living. So
thank you. I'll take that under advisement.
No, I one of my favorite things working with my students, because I'm not in the classroom as much. I'm covering a few classes. I'm more in the background. But when I'm in there, two of my favorite things to do is talk about how we're part of a healthcare team, and this discussion about not relying on doctors to give us the permission for things that we need to be more important, to think of ourselves as more important and more knowledgeable and figure out what we don't know, kind of thing. But also the part I love showing the students how to use their books better. It's one of the ones, and like, you have this tool, it's amazing. That the trail guide is another one that I think like, did you know it does this too? And both of them by Books of Discovery that carry the both books. I love them over there. But to help them break down the pathology book, because it can seem a little overwhelming, just like pathology is overwhelming, and how you've broken it down for everybody, and everyone else contributing to it as well to help us understand. But the one thing too that you said during our first talk back in 2021 about how you wrote the book, and I'm paraphrasing, probably going to butcher this a little bit, but when you understand what the system does, what the digestive system does, reproductive system does, whatever, and then you understand what happens when it's not working right, you can make those decisions, and understand what massage does. You can kind of make those decisions of how to better make those treatment plans. And that's essentially what your book put out for all of us. So we don't have to do that thinking as much. You've put that together for us, explaining, because that's how the book's laid out, right? You explain the system, explain what happens.
Here's what happens when this part of that system fails for whatever reason.
Right.
And a lot of the way I explain that, Michelle, I'll add one more part of of what you just said, which was quite accurate. Mm-hmm. But there's one more part, which is when we talk about the pathophysiology, which is basically what's busted, right? Mm-hmm. Well, how does this condition change the way we function?
Right.
Right. That's what leads to the signs and symptoms. Mm-hmm. So what our client presents to us is the signs and symptoms. If we can understand how they developed, like this is a rash, there's a sign or symptom, but where did it come from? Did it come from the fact that you are allergic to the nickel in your watch? Or did it come from the fact that you are allergic to the detergent that has permeated my massage sheets? Mm-hmm. Those are going to lead to two really different kinds of decisions. Yeah. Right. So, understanding the pathophysiology helps us understand where those symptoms come from. And that's, that's where we're going to find those decision points. Yeah. Yeah. Which is so important to our whole discussion here about how we're going to come up with, and having that information, because this is the other part too, like
students like, I don't really need to know that. I just need to how to do this, or whatever. Not everyone, but sometimes people diminish it down to like, I'm just doing this. It doesn't really matter. And like, why do I need to dive that far into it? And why do clients need to fill out intake forms? And why do doctors need more than just, yeah, it's okay or not okay? Is the more we understand about it and the more we're able to communicate and explain it to our clients and then explain it to the healthcare team to get that dialogue. That's where it's all those pieces are coming together from that understanding and from us wanting to take participating in that part of the process too.
And I'm glad you bring that. I'm glad you bring that up because I've had this thought a couple of times during our conversation. One of the aspects of our sort of healthcare culture in the United States. There are many problematic things about our healthcare culture, but one of the things that I think is maybe some of the low-hanging fruit that can be addressed is the way people silo themselves. So the PTs are over here, and the MDs are over here, and the surgeons are over there, and the OTs are over there, and the massage therapists are sort of off out of the circle a little bit, but peeking over the shoulders of people.
Let me play.
Yeah, I want to play. I have a comment. But the more we, and by we I mean everybody in all of those silos, the more we open our minds up and reach out to people who are maybe operating in a different silo, ultimately I think we're going to get to better outcomes for clients and patients. And the hidden sort of cultural benefit of establishing good communications with people's healthcare takers is that it begins to break down the walls between those silos, so that if you have a good, highly informed discussion with a general practitioner about their person with migraines and they're getting Botox injections, and you want to know how to be safe and make sure those Botox injections are as effective as possible, the next time he has a patient with migraines who says, I just, what else can I be doing to help with this? He's going to think, or she's going to think of you. Right. So, as we open up these lines of communication, we are potentially building our practice. We are expanding our referral network because, if you're corresponding with a doctor who's responsive, and you get a client who says, I really need a good GP because mine is not responsive, then you have a suggestion, right? So there are so many benefits to opening up these lines of communication, in addition to the main one, which is how can we be safe and effective for this client who's on the table.
Yeah. Oh, I love that. That's so perfect. It was such a great way. I know we're running close to our hour here together. Yeah, it's a great way to put that together. And I just feel like empowered for people to take these suggestions and run with it and make their practice better, their clients better, and make massage therapists look like we're pretty cool people.
Yes, we are.
Yeah, absolutely. One final question, because I usually ask 5 questions at the end of my a live stream, some like personal ones. And so instead of asking all of that, I'm just curious, do you still want to breathe underwater as your superpower? If you had
is that what I said before?
Yeah, you said you wanted to be able to breathe, be able to swim indefinitely, so you could breathe underwater.
Oh, wow.
Yeah.
That's cool. I wouldn't have thought of that. Yeah, absolutely. Yes, please.
Yes, please. And it was for something about being like some quilting skill that you wanted, but then you switched to your swimming.
I can develop quilting skills. It would probably, that would be easier than developing the skill of breathing underwater.
Yeah. Just a little, just tiny bit. Here. Beautiful. Thank you so much, Ruth. I really appreciate you taking the time out today. And I've gotten a lot out of this, and I know our students will really appreciate this discussion. And thank you and Alyssa for creating the forms for us and the ebook and everything that's going to help support and get these dialogues started and get them going with everyone. So I really appreciate your time today.
Absolutely. Thank you, Michelle. It's always a pleasure. And thank you to our audience. And especially your students.
Yes, thank you so much. Okay, everybody, we'll see you next time. Take care. Bye.